Millions suffer from diabetes, a leading cause of amputation in the United States. Today, a breakthrough procedure called the Dellon is helping people with diabetic neuropathy avoid amputation, giving them a much-needed second chance. With more on symptoms of diabetic neuropathy and the Dellon procedure, here again is Dr. Richard Jacoby.
Every 30 seconds, there's an amputation in the United States due to diabetic neuropathy. It doesn't have to happen. Now, when I first started in Philadelphia, that was not the case. 30 to 40 years ago, most people had an amputation because of arterial disease, not diabetic neuropathy. Today, we have the diagnostic instrumentation. We have excellent ultrasounds. We have nerve conduction velocities. We have MRIs. We have all the things that are necessary to make that diagnosis. But what is more important even than the diagnostics are the symptoms. When you get numbness, tingling, burning, or loss of balance in your feet, that's the early indicator. It's like you're sleeping at night and the alarm system went off and you got up in the middle of the night and you turned off the smoke detector. Even in the absence of a blood test that says you don't have diabetes, there may be symptoms such as migraine headaches are one of the symptoms, sinusitis, thyroid disease, irritable bowel. These are all precursors to that process. So I don't look at it as just the peripheral neuropathy. I like to say peripheral neuropathy, that the pain that is developed is the warning sign of impending serious problems.
Diabetic neuropathy generally presents in 5 distinct phases.
Phase 1 is numbness and tingling. Comes and goes. It may be months between the symptoms. That's an early warning sign. Phase 2, those symptoms are more frequent and more intense. Phase 3, you have pain all the time. You can't sleep. That's the critical stage. That can be fixed only with surgery at that point. Phase 1 and 2 is probably diet and supplements and change of behavior and exercise. Phase 4, lots of patients tell me, I'm all better, doctor. I have less pain, less tingling. You're getting more compression around the nerve. You're losing feeling. When you hit phase 5, you have no feeling whatsoever. That's when you look at the bottom of your foot and you got a hole in it. And that's when you're going to head for an amputation. That's not the time to intervene. The time to intervene is in phase 1.
Dr. Jacoby is one of the few surgeons in North America specially trained to perform the Dellon procedure.
Because of the Dellon procedure, we don't have the amputations. We decompress nerves just like you do in the upper extremity. I've done over 2,500. We haven't had an amputation as of yet in the last 12 years. We have restored sensation in 85% of our patients. And we have had very few reoccurrences of ulcerations. That's a remarkable story considering every 30 seconds there's an amputation. It doesn't have to happen. Not with the Dellon approach. Not on my watch. Today we have the new technology. So we can get patients better, faster, less expensively, and much more efficiently. No one should be without this care.